Infectious disease experts are weighing the need for booster shots of the mRNA vaccines for those Americans who received the J&J vaccine amid concerns over how effective the single dose is against the more contagious Delta variant. Available data does confirm the efficacy of the mRNA vaccines against the variant, either Pfizer-BioNTech or Moderna, but the science is less clear about the single J&J dose against Delta, which is highly transmissible and associated with more severe disease. The CDC is closely monitoring the prevalence of the Delta variant in the United States.
In the last 2 weeks, the prevalence of cases resulting from the Delta variant has doubled to just over 20%, as Dr. Fauci just showed. This variant represents nearly half of all infections in HHS regions 7 and 8. This is concerning but expected, knowing what we do about how efficiently this variant spreads, and by what we saw in the United Kingdom with this variant. We know our vaccines work against this variant. However, this variant represents a set of mutations that could lead to future mutations that evade our vaccine. And that's why it's more important than ever to get vaccinated now to stop the chain of infection, the chain of mutations that could lead to a more dangerous variant.
Experts are now weighing the option of following the single J&J shot with a second mRNA dose in order to produce a stronger immune response against the Delta variant, while studies in the United Kingdom show that 2 doses of either Pfizer-BioNTech or AstraZeneca are significantly more protective against the variant than the single J&J dose.
Here is now some of the good news. And one of our tools, the effectiveness of the vaccines, in this case, 2 weeks after the second dose of Pfizer-BioNTech, was 88% effective against the Delta and 93% effective against the Alpha when you're dealing with symptomatic disease. When you look at hospitalizations, again, both the Pfizer-BioNTech and the Oxford-AstraZeneca are between 92 and 96% effective against hospitalizations. You put all of these things together and you come to what we would call a self-evident conclusion. Similar to the situation in the UK, the Delta variant is currently the greatest threat in the US to our attempt to eliminate COVID-19. Good news, our vaccines are effective against the Delta variant.
Johnson & Johnson says it's testing whether the immune response from its vaccine is capable of neutralizing the Delta variant in a laboratory setting, but no data is available yet. Health experts emphasizing the importance of getting vaccinated in order to reduce the likelihood of new COVID-19 mutations that could pose additional challenges to the efficacy of existing vaccines. Sherwin Bryce-Pease, SABC News, New York.